Hi, welcome back to my channel. If you're new here, welcome. My name is Aminata. I am a nurse practitioner and I work in outpatient psychiatry. And if you're a returning viewer, thank you so much for coming back. I appreciate your support and for watching this video. So I know everyone, the new year is here. People are making different new year resolution, whether it's losing weight or working on your finances. And today I kind of wanted to talk to you guys about maybe a new year resolution for you this year, if you have been struggling with your mental health, is to be able to get your mental health in order. So I wanted to talk to you guys about one of the most common diagnoses when it comes to our mental health is anxiety disorder. So there's so many different types of anxiety disorder. Today I'm just going to focus on some of the signs and symptoms of generalized anxiety disorder, and which is one of the most common ones. So we're going to talk about what are some things to watch for, so that way you can kind of figure out, okay, maybe I do have anxiety going on. And also we're going to talk about what are some of the causes of anxiety. So where does it stem from? There can be so many different things. And then we're going to talk about what do you do afterwards if you figure out, or if you feel as though you're struggling with anxiety disorder. So that's pretty much what this video is going to be about. So first of all, what I wanted to talk about is how we go about diagnosing patients, especially with mental illness. It's based on pretty much this book right here. That is the DSM-5, and that pretty much stands for Diagnostic and Statistical Manual, and it's the 5th edition. And now you know why we just go with DSM-5, because if I sit here and keep trying to say that all the time, I'm probably going to confuse myself and ended up being anxious about it. So that's pretty much the book that we use that tells us how to go about diagnosing individuals with mental illness. So first, we're going to start with some of the signs and symptoms to watch for that are common signs and symptoms of anxiety that you need to watch for. So first of all, one of the first signs is difficulty with concentration. So you have a difficult time paying attention when you're doing tasks or focusing. Another signs and symptoms to look for is worrying too much, and you can't stop yourself from worrying, and it can be about different things here and there, and you just can't seem to be able to stop worrying. Another thing would be feeling on edge, where you feel or feeling anxious a little bit. And sometimes some people experience symptoms of feeling restless, where they can't just seem to relax and settle down. Some other signs and symptoms of anxiety involves irritability. So that one, you see that a lot in younger adults and kids. So you see a lot more irritability than anything else as a sign of anxiety. Some other signs of anxiety that you can watch for is troubles with sleeping. And a lot of the time people will say, I have trouble sleeping because I can't seem to just relax my mind, and I just feel as though my mind is always going, my brain is always going 100 miles an hour and thinking about different thoughts. So that's usually what we call racing thoughts. And in order for you to have a diagnosis of anxiety, you need to have at least 6 of these symptoms present for at least 6 months. So those are some things to kind of watch for. And some people have what they call somatic symptoms, such as they get nauseous. Some people have diarrhea, which is one of mine. When I'm nervous, and I realized that earlier on in high school, that when I'm anxious about something, and I feel as though I have to go to the bathroom. So that some people get diarrhea, some people, their hearts start racing, some people feel nauseous. Some people have issues such as excessive sweating, where they just sweat a lot when they get anxious. So just recognizing those signs and symptoms, you're able to know that maybe, yeah, I do have some anxiety going on. And I remember when I used to work in inpatient, we used to have so many people that comes into the ER, and when I worked there as a nurse, and they come into the ER or they ended up in the ICU because they are having anxiety symptoms, but they feel as though they're having a heart attack. So they ended up doing all these different labs, and everything comes back negative, just to find out that nope, it's just anxiety. So, and it can be very, very debilitating for people. So for some patients that have anxiety, we kind of look into, is that affecting different areas of your life, such as your personal life, where you are calling off from work because you felt anxious, or you are avoiding social situation, or you're not hanging out with your friends because you felt anxious. Or so just pretty much looking at, is it affecting areas of your life? That's a major thing also when it comes to diagnosing anxiety. So we're going to go into what are some of the causes of anxiety. And honestly, sometimes it's just genetics. So kind of when we have our parents, they pass on things to us, and sometimes it's not the long, beautiful hair, brown eyes, or blue eyes, and all that good stuff that comes with genetics. Sometimes they pass on to us some of the things that may not necessarily be pleasant. So some of it is like anxiety disorders, different types of mental illness, or sometimes it can be physical illness like diabetes, hypertension, and things like that. So it just depends. Sometimes it can be based on just genetics. Some people anxiety is based on trauma, so they've experienced childhood trauma or adult trauma, PTSD and things like that that may cause them to have anxiety disorder. Some people is environmental, it's based on, again, maybe where you were raised or where you're still staying. Maybe that environment is not so safe, and some people can constantly feel on edge or worrying that something bad may happen, and things like that. And some other factors can just be some people, sometimes it's nothing. Honestly, sometimes you just get anxiety for no reason, or they can't seem to figure out what's causing it. And again, some people, it might just be, especially when we're talking about COVID and everything that's been going on, some people it's because of lack of security, whether it's job or safety or whatever the case might be. And it's almost unreal for what people have been through when it comes to 2020. If you're not anxious, it's almost like one of those things where you kind of think that it's not normal to not be anxious. And a lot of the time, a little bit of anxiety is good. But what we're talking about here is when it's gotten to the point where it's affecting your personal life, in different areas of your life, such as work, home, family, and things like that. That's kind of what we're talking about. So what are some things that you can do if you notice that you're experiencing anxiety, or if you notice a family member or loved one is experiencing these symptoms that I just talked about? Is making sure that you seek professional help. So going to go talk to a licensed therapist or a psychiatrist or a psychiatric nurse practitioner. So going in there and talking to these people, and a major important thing is also to make sure that when you go talk to these professionals, they're able to rule out potential other causes of anxiety. Maybe it could be because you drink too much coffee. Maybe it's a thyroid issue. So for some people that have hyperactive thyroid, that can cause anxiety. Some people, it may be related to brain tumors. Some people it's related to substance abuse, especially with cocaine. You see that a lot when people use cocaine. Again, when I used to work in patients, some people come to the ER, feel as though they're having anxiety attacks or panic attacks or having a heart attack, but it's based on substance abuse. Sometimes it's based on medications that we use, such as medications that we use for ADHD, like Adderall. Some people may have anxiety and it's related to that. So you want to really go in and talk to a professional, so that way you guys are able to rule out some outside factors that might be contributing to anxiety. So that way, maybe when we just get rid of those factors or help fix the medical problem, if that's what your issue is, then we don't need to be on medications. Or even if we need to be on medications, we might end up being on lower dose because we're fixing the primary problem. So that's pretty much it for this video. I hope this video was helpful. Make sure you like this video, and be on the lookout for another video that talks about signs and symptoms of depression, as a lot of the time anxiety and depression go hand in hand. And that's pretty much it for this video. Until next time, stay positive, be kind to one another. Happy New Year again, and I'll see you guys on my next video. Take care, guys.